Welcome to our information skills video tutorial containing more PICO examples. By the end of this video, you will have gained valuable experience in constructing a PICO from a clinical scenario, dividing your question into distinct components or concepts.
This video is 10 minutes long, and for each of the 10 clinical scenarios that follow, first listen to and read through the scenario. Then you'll have 10 seconds to write out the PICO for that scenario. Answers will be revealed on the next slide. Pause the video at any point if you need more time to consider your answer. A 55-year-old man with newly diagnosed stage 1 hypertension asks whether starting ACE inhibitors would be more effective than beta blockers in reducing his long-term risk of cardiovascular events.
A GP wants to know if delayed antibiotic prescribing compared with immediate antibiotics reduces unnecessary antibiotic use without worsening symptoms in children with acute otitis media.
A 30-year-old woman with generalized anxiety disorder wonders if mindfulness-based cognitive therapy is more effective than standard CBT for reducing anxiety symptom severity. A physiotherapist is evaluating whether strength and balance training versus usual care reduces the number of falls in adults aged 70 or older living in the community. A 45-year-old man with prediabetes wants to know if an intensive lifestyle program, diet and exercise, compared with metformin, is more effective at preventing progression to type 2 diabetes.
In adults undergoing abdominal surgery, A surgeon wants to know whether using regional nerve blocks compared with systemic opioids alone reduces postoperative pain scores and opioid consumption. In patients presenting with acute dizziness, clinicians want to know if the HINTS bedside exam compared with early MRI is equally or more accurate at diagnosing posterior circulation stroke. At 41 weeks, a pregnant woman asks whether membrane sweeping compared with expectant management increases the chances of spontaneous labor and decreases the need for formal induction.
A health promotion officer wants to know whether smartphone-based cessation apps, compared with printed smoking cessation leaflets, improve quit rates at 6 months among adult smokers.
Clinicians want to know if giving a heterologous booster dose, for example, mRNA booster after adenovirus vaccine, compared with a homologous booster, improves neutralizing antibody response in adults.
Well done! You've reached the end of this video tutorial. You should now feel more confident in being able to extract a PICO from a clinical scenario, dividing your question into well-defined components or concepts.